What really happens during open heart bypass surgery? Step by step inside the operating room. Most people hear about heart surgery but never truly understand what happens inside the operating room. Yet every day, surgeons perform a life-saving procedure called coronary artery bypass graft, restoring blood flow to hearts that are slowly being starved of oxygen. Let's walk through the operation step by step. The moment the patient enters the operating room, the room is bright, sterile, and filled with advanced medical equipment. A full surgical team is present: cardiac surgeons, anesthesiologists, nurses, and technicians. The patient is placed under general anesthesia, meaning they are completely asleep and feel no pain during the procedure. Monitors are attached to track heart rate, blood pressure, oxygen levels, and brain activity every second. From this moment on, the team controls every function of the body with precision. Opening the chest. To reach the heart, surgeons perform a procedure called a sternotomy. This means carefully opening the breastbone sternum to access the heart and major blood vessels. Although this sounds dramatic, it allows doctors full visibility and control. Special surgical tools gently hold the chest open so the heart can be clearly seen. At this stage, the surgical team can examine the blocked coronary arteries connecting to the heart-lung machine. In many bypass operations, the patient is connected to a machine that temporarily takes over the work of the heart and lungs. This device is called a cardiopulmonary bypass machine. It pumps blood through the body and adds oxygen while the surgeons operate on the heart itself. This allows the heart to be still and safe during the delicate procedure. Harvesting the new blood vessel. Next, a healthy blood vessel is taken from another part of the body. Common sources include the leg saphenous vein, the chest internal mammary artery, the arm radial artery. This vessel will become the new pathway that carries blood around the blockage, creating the bypass. Now comes the most important moment. The surgeon attaches one end of the harvested vessel above the blocked coronary artery and the other end below the blockage. Once connected, blood can flow freely again, bypassing the dangerous obstruction. If multiple arteries are blocked, surgeons may perform double, triple, or quadruple bypasses in the same surgery. Restarting the heart. After the grafts are securely attached, the heart is gradually restarted and allowed to pump on its own again. The surgical team carefully checks blood flow, rhythm, and stability. When everything looks perfect, the heart-lung machine is disconnected, closing the chest. The breastbone is carefully wired back together, and the incision is closed layer by layer. The entire operation usually takes 3 to 6 hours, depending on how many bypasses are required. The first moments after surgery, the patient is moved to the intensive care unit where doctors monitor heart rhythm, blood pressure, breathing, oxygen levels. Most patients begin waking up within hours. Within days, many are already sitting, standing, and slowly walking. Why this procedure saves lives? According to specialists at the Cleveland Clinic, bypass surgery is one of the most studied and successful heart operations in modern medicine. For patients with severe coronary artery disease, it can restore blood flow, relieve chest pain, prevent heart attacks, extend life. Something many people don't realize. By the time someone needs bypass surgery, their arteries have often been narrowing silently for years, which raises an important question. What habits today are shaping the future health of your heart? Because sometimes the most powerful heart treatment is not surgery, it is prevention. If you found this educational and exciting, please subscribe, like, and comment your thoughts below. Tell us, what part surprised you the most?